Hello and welcome to EMS Research with Professor Bram, where we talk about the research-related issues that matter to those who work in emergency medical services. Today, we'll be talking about challenges that are faced by EMS rule providers. Welcome to the EMS Research Vlog and Podcast from the studio here in Houston, Texas. I'm your host, Bram Duffy. I'm a full-time paramedic on the street, like many of you. I also have an appointment as a research fellow with the Institute for Social Innovation at Fielding Graduate University, and I'm an assistant professor of communication at Kennesaw State University. I actually have a research study open now for first responders, so if you don't mind being interviewed by me, then go to my website and check it out, www.professorbram.com. It's professorbram.com. You just click on the current research tab to apply. The other thing to share before we get started, I have written 2 different books on communication. And the most recent book was just released called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. You can find a link to the book below. Also, for sure, hang out to the end and I'll tell you more about it. Hello, everyone. I'd like to introduce you to Jessica Thompson. I found Jessica because she wrote an article in JIMS, March 2024, called Rural EMS in Crisis. And she has been involved as a ground provider since 1998 and as a paramedic, and currently works for the Northern California LEMSA, where she deals with struggles facing rural emergency medicine. So hello, Jessica. Welcome.
Hi, thanks for having me.
What else do people want to know about you that I wasn't able to share just now?
I've been a paramedic since 1998 as a ground provider, and I've worked very closely with rural EMS my entire career in where I was born and raised. And now I've transitioned into an EMS specialist job, which is actually a local emergency medical services authority. So we are the regulatory agency for ground providers, and we're one of 34 in California. And my new region is very, very rural. So I've been in this position for about 6 months and have learned a lot more than I ever knew was out there for the rural EMS problems.
Well, I really appreciated your article. And what I found from that was that in many rural areas, accessing EMS is just increasingly challenging. And so this is something that's worsened health outcomes for residents. And these regions face a critical shortage of specialized care and basic medical services. And this is all compounded by difficulties in retaining healthcare staff at all levels. So recent years have seen these issues intensify because of new regulations, rising cost, and the significant impact of this great resignation that happened around the pandemic time. And especially EMS folks were hard hit by that on lots of levels. And so we recognize that EMS professionals are really crucial, but at the same time, they're some of the lowest paid and most stressed workers in the healthcare system. And so these are the folks that are facing burnout and mental health challenges, all while there's just not that many of them. And a recent example from a rural area in Northern California that you shared highlighted a sharp decline in emergency medical services due to just finances. And so that's stuff that leads to reduced services or complete shutdowns. I guess that's fine if there's no population there, but there's people still there. And so this problem isn't just isolated to California, it's nationwide. And this is an issue that affects numerous rural communities, and the financial struggles faced by EMS providers, and then you take the outdated reimbursement rates. These are a recipe for financial, economic collapse. And it doesn't just affect the immediate area, right? Because it puts an additional strain on all these neighboring services of mutual aid and causing a domino effect. And the stuff worsens response times and stretches resources thin across the whole region. And as agencies scramble to fill the gaps with these mutual aid agreements, and other makeshift kinds of solutions. It's just the capacity to provide timely and effective care. It just diminishes and doesn't really leave the community with much to work with. And I think about the moments of crisis where every second counts. When you have a baby not breathing, when you have, you know, a just some of the most horrible traumatic things that can happen to folks, and then all the while the time ticks, for that patient to get to surgery, to fix their emergency, and there's no EMS there. And I think that some systems are even set up so that it's difficult um, to get a helicopter, right? So
Mhm.
this is wild and crazy right now. So tell me, what led you to investigate these challenges, and how did you get into this yourself?
Well, like I said, I had started a new job, kept my old job, and was still working on a ground ambulance. So I knew from my new job, my new EMS specialist position, that there had been two ambulances in our region, which is covers 5 counties, and there had been two ambulances that had not been able to provide transport services any longer. They were both ALS, Advanced Life Support, and just due to financing and budgets and all of the grants and special money that they were able to get in the meantime to keep them afloat had run dry, and they were forced into closure. So uh, it just left a huge hole. New Year's Eve, I was working a night shift for my old job still, and we were actually called about an hour away from our response area as the last ambulance in our county. And it's pretty urban, about 85, 89,000 people in our county, very busy system. And we were called as the last unit up to this rural community that was covering the area that had closed down. So it did create that domino effect you were talking about, where this big open area no longer had an ambulance. There was a need. They had an incident and somebody had to go. The next closest ambulance was the one, down the mountain that ended up going. And so we got called up the mountain. An hour response time before we would even get to a patient. I believe it was an hour and 9 minutes was the original time that we saw, and that was a little bit difficult to swallow. Not to mention that when you leave our little hub, you start to go up mountains in every direction. Every single area around us gets to at least 4 or 5,000 feet elevation within about 20 minutes. And this rural community had been hit by some snow, and most of the ambulances in our county are not 4-wheel drive. So to respond into these areas is dangerous. It's
Mhm.
time consuming, and it's not really most of our comfort zone to go this distance. And it just really opened my eyes to what was going on and how we were kind of felt protected because we did have an area with so many ambulances on during a 24-hour period. But how as soon as you left that bubble, there's people waiting an hour for a heart attack, waiting just an immense amount of times to get care. And with snow, with bad weather, they're not going to be getting helicopters up in those areas. And so they will be waiting, and then a transport time on top of that to any kind of stroke receiving, STEMI receiving, trauma receiving centers, then is all the way back down the mountain. So it really just was shocking to me how bad things had gotten. Over the last 25 years, here and there, we would lose a provider for a couple of days or maybe in a week. But this was the first time that we actually lost a provider for consistently, and we knew they were going to be down and going to be down for long term. We're still trying to help them, trying to find funding and trying to get them back up and going. I know they're all scrambling to restructure however they can, and we're trying to fill the gaps. But that's what really made me think something's got to change. And I didn't even know if people in this area were aware of how bad it had gotten.
So to make things bad, do you know about like how we got here? Like as far as state regulations or cost factors or staffing, or I mean,
Mhm.
because 10 years ago, these are services that were in place and now they're not. So do you have any insights?
Well, I think one of the biggest factors is the cost of living in California. It is not only are we one of the heaviest tax states, just as every person, every resident here already, but paramedics still here are starting out, at $19-20 an hour, ending up making, maybe if you're lucky, $52,000-$55,000 a year, but the average mortgage payments between $2,000 and $4,000. Currently, gas prices are back up to $5 a gallon, and that's actually in an area where we usually have lower gas prices than a lot of the state. If you were to go into San Francisco right now, gas prices are most likely over $6, and that's pretty consistent with most of the big cities, but it's hitting even the rural communities now where $5 for a gallon of gas. Diesel's actually running still a little bit higher. Most ambulances around here are four-wheel drive, especially in the rural communities. So they can have they have the diesel engines with the four-wheel drive, so they can get to the areas they need to, and that's just a huge increase. The utilities in California have gone up consistently every single year, and that's a response from a lot of the wildfires. We had a massive wildfire here locally not very long ago, followed by 3 or 4 more the next summer. And all of our areas were hit so hard, and the restructuring to get those utilities back in place is costing all California residents massive amounts of money. And on top of that, that's all operating cost increases. So every single rural ambulance now is paying more for their utilities, more for their even things like the communication and dispatch fees, which they haven't had to do in the past, just because everybody down the line is experiencing cost increases. Just keeping our equipment coming and supplies coming in is costing more every single order that's put in, and it's finally caught up.
So why do you think it is that rural communities that feel the brunt of this are unwilling to provide subsidies to keep their ambulance services going? Do they not know better? Do they not have the money themselves? What's going on there?
Well, one of the providers that closed, they actually have a tax assessment, and they were able to get they're able to get funds yearly. For the total out of the tax assessment, they're getting around $200,000. Two
Which is
hundred
nothing.
thousand dollars is nothing when it comes to the operating cost for one ambulance, 24 hours a day for 1 year. They keep their cost so incredibly low because they're able to rely a lot on volunteer help, and they get a lot of additional funds and grants from here and there. But even then, they're able to bring in about that 200,000 to 300,000. But even with the lowest projected operating costs, they would need double that minimum just to be able to staff that. So the people in the area are aware of it, and they've done some great things to help. These are wonderful communities who band together and are willing to really go the extra mile to make sure that there's care in place. It's just not feasible. And adding more taxes to these already, pretty poor stricken areas is not feasible. It's gotten to a point that it's much beyond the little communities can take care of themselves.
Wow. So if the community can't do it at that level, then it moves to the county and the state level, right? So
Mhm.
are there enough, is there enough concern happening to move things forward? It's like it's really scary. Maybe folks need to think about their vacations. Like, are you going
Yeah.
to travel to a rural part of the country? Because
Yeah, and we're seeing that as well, where there is some decrease in tourism just based on, just even lack of simple services. Hotels are closing, restaurants are closing. Some of the areas I travel into to do inspections and take care of different committees are, I would have been there 10 years ago and had 15 options for lunch, and you're down to 5. So just little things like that. The local grocery stores are closing, the movie theaters are closing. Most of the storefronts are now empty in these little communities. So it's everybody is struggling, and they're doing what they can. It's gone way beyond a local level, and most of these county governments, especially within my LIMSA, the county governments, there's no extra funds to put into ambulances or into really any kind of EMS providers.
yeah, well, it looks like a national system is the savior here, but I don't think that's happening anytime soon. So from your
No.
perspective, what does the future outcome or outlook look like for folks who live in the rural areas?
Well, I would say it's very bleak. There's so much mismanagement of funds at the state level in California. I mean, we have a $4 trillion state gross product. We're the fifth largest economy on the entire planet, And yet we're facing a historical budget deficit this next fiscal year. And to put that into perspective, it just comes down to we're not balancing our checkbook. When there's no money in the checkbook, you don't go on vacation. You don't go buy a fancy car and furs and jewelry. You tighten the belt and you get by with less. And California seems to kind of enjoy the high life maybe a little too much. I see a lot of wasteful state spending. I see a lot of mismanagement of funds, and until that's taken care of, there is no bright side to any of this. It's going to end up with prolonged 911 waits. What would have been a 20-minute ambulance ride is going to be an hour now. It's going to increase mortality. It's going to it's leading to some really, really difficult times, and people don't realize, but those patients are, a lot of these hospitals have closed as well in these areas and reduced services. Things like obstetrics is gone, things like having a CT scan, having the staff to operate a CT scan. A lot of these services have been closed down. And so now these people have to be transported who could have been cared for at their local hospital are going to have to be transported out of the area. So that's another burden on an ambulance, is taking them out of service to do a long distance transport to a facility that can handle their care. And it then puts a strain on that facility to be able to see the patients in their own community when now they're taking in a massive amount of patients from out of the area, just due to hospital closures and a lack of services. It's at the breaking point, and I think that we're at this precipice where if we don't change something and change it soon, we're going to see a lot more providers in these next 2 years that aren't going to be able to stay in service.
Yeah, I have friends that there are two friends that come to mind that have owned ambulance services that were rather large that aren't in the business anymore, and they say it's just not financially feasible. It doesn't make sense. And so if if you can't make the numbers work, then it's gosh, it means for a decline. And so maybe things have to get worse before they can get better. But the focus on having a national type system seems to make sense. It's like like maybe something that Australia has, or something like that, because I'm thinking about how California is probably the biggest depositor of federal funds, right? It's probably there's probably more money that comes from taxes out of California to go to the federal budget compared to all the other states, probably. So it's just a shame that we can't figure something out.
But California is kind of its own zebra, because we have a county like Modoc County, which is about 4,000 square miles. LA County is also 4,000 square miles, but it has a population of 10 million, while Little Modoc County has a population of like 8,000. So when you start to look for state and federal funds, one of the biggest problems is that there's no metric currently that would provide where the need needs to go. What happens is a lot of those funds go to the big dogs who have very large populations to help them, instead of going to rural communities. And people forget that equality means everyone. Equality isn't, segregated for a race or a gender or a group of people. Equality is for everyone, and that includes everyone in every zip code. And these are rural Americans that provide, some of the most food for the entire planet, and they need to be considered too when it comes to equality and equitable care. And they've kind of gotten lost in the shuffle. And a national system, which may be the way to go, would just have to address things like that. And in California, when people start putting their hands out for funds, usually you get these big counties with lots of legislators and lots of dollars that are able to go capture more funds. And the little rural communities that don't have that power and that money to put into it in the beginning end up losing out completely.
Wow. Yeah. So I just think about the person who has lived all their life in that rural area and has their family, has their job, has their, their everything there. And now all of a sudden, they don't have an ambulance. And so you can't just uproot yourself in your whole life just because something falls out like that. These people are stranded. So I appreciate
Yeah.
that your advocacy for this, and
Thank you.
this is the kind of thing that this blowing the whistle on these problems is the kind of thing that hopefully can move things forward so that we can get good quality care for our folks. And it's just surprising to be talking about this because I am on I'm on some I have relationships with groups where I myself am trying to make EMS better in other countries like Taiwan and like Portugal. And in those two countries, for example, it's basically just EMT level or below care, So
Mhm.
my advocacy for them is to push for them to move into a paramedic level, services for their country. And here we can't even get we can't even get a regular
Yeah.
ambulance to folks in here in the United States. So it's it's a big task to take up, and it is um, in my view, it's all part of the conversation that happens in politics about healthcare. And is this something that is for everybody? And that question happens with everything in politics, right? Is education for everybody? Is healthcare for everybody? Well, someday it's going to be, the question is if everyone deserves water, even, right? Because even water costs. So it's just it's wild and crazy, and I think we have to um, put the pin in the right spot to move it forward.
Mhm.
So, any last words?
Absolutely. Well, we are doing what we can do here in Northern California to see about funding and, forming coalitions and that kind of thing to take forward. And eventually it will be a statewide movement, and hopefully, someday down the road, a national movement. And it will focus specifically on rural EMS and how to keep them funded, long-term sustainable type thing. So
For
here's
real?
hoping.
Well, paramedic Jessica Thompson, EMS specialist, all the way from California. Thank you so much for being here with us.
Thank you.
I want to also invite you to check out my latest book. I co-authored a book with Four Arrows, who has 2 doctorates and is an expert on indigenous scholarship and hypnosis. So I just wanted to invite you to check it out because we introduce a method for communicating with patients on the scene of an emergency that takes advantage of some of the properties found in hypnosis. The book works to change the way we approach and interact with any emergency patient in acute distress, and it can help you be a better practitioner. The book is called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. You can follow a link below or find it or go to almost anywhere books are sold. If you contact me with proof of your order, I'd be happy to mail you an autographed sticker that's designed to put in the jacket cover. So send that over my way.
Hi, I'm Will Chaplot from the International Pre-Hospital Medicine Institute. You might know about us because of the literature reviews that we post every month free for your review on our website at iphmi.com and also published through GEMS Online magazine every month. We've been doing them for 5 years, so now we've accumulated over 240 literature reviews over the past 5 years. And we've gotten feedback from our audience that said they'd like to have these things as desk references, so they'd had a rapid reference. Well, we've done it. And there are now 5 volumes of these books, one for each year that we've been publishing them. This is the latest version, volume 5. And as I said, in each of these, there's at least 48 literature reviews. They're all cataloged in the beginning of the book, so you can see what the topic area is, what pages those reviews are on, and how you can find them quickly. And again, these are a great reference, whether you're putting a lecture together, working on a paper, studying, whatever it is. This gives you the depth of field of the science that dictates what we do in the field or what we should be doing in the field or why we've changed the way we do things in the field. In any event, as with all of our publications, we've priced these because we want you to be able to have this book. It's only $4.99 in the hard copy here, and all 5 of them are available at that price. But you can also get them as ebooks, and they're available as ebooks from Amazon, from Apple, from Barnes & Noble, wherever you get your ebooks for the price of $2.99. So again, we don't do this with an aim towards getting wealthy. We do these because we want you guys to be able to have these materials. Relevant information, affordable information, and an access so you can get to it. So you want the hard copies, go on Amazon, $4.99. Go to your ebook store and you get it for $2.99. If you're in the business, this is the kind of material you want to have around to settle those firehouse arguments or to help you put your materials together. Thanks again. See you all soon. Thanks.
I'm doing a research project related to first responders who live in the United States, and I could use your help. If you don't mind being interviewed over a video call, I'd like you to go to my website and fill out the form at www.professorbram.com. It's professorbram.com. Thank you again for listening, and I look forward to sharing more insights with you in the next episode. If you enjoyed EMS research, please tell your friends and like, share, and subscribe so that you help others get this message.